Now let's talk health. Brits are always looking for the next quick lifestyle fix to improve their health. Yet new research reveals that we are not doing enough in terms of long-term lifestyle changes to improve our health and well-being. Heart disease is the UK's biggest killer, yet the majority of Brits take no active measure to reduce their blood pressure or cholesterol, despite many of us knowing someone who's been affected by the disease. Most of us claim we understand the causes of heart disease, but it seems we are not doing enough to prevent it. So what is the sensible approach to improving our heart health? That's what we want to find out this afternoon. Joining us to discuss this further is GP and registered nutritionist Dr. Sarah Brewer. Good afternoon, Dr. Brewer.
Hello.
Hello. What does research reveal about heart health in the Nottingham area?
Well, the research on behalf of Works with Water found that in the Nottingham area, only 22% of people didn't understand the causes of heart disease, and that's actually quite significantly better than the UK national average, which was 32%. But it also showed that 45% of your listeners do know someone who's been affected by heart disease.
Okay. So what are the causes of heart disease?
Well, coronary heart disease is basically due to hardening and furring up of the arteries, and that is something that partly occurs with age, partly as a result of the genes that we've inherited, but one of the main influences is our diet and lifestyle. So if you smoke, if you don't take exercise, if you eat a poor diet with lots of the bad fats, lots of takeaways, and not much fruit and vegetables, then it's possible that you're heading that way.
So why is heart disease Britain's biggest killer then?
Well, again, it comes down to our diet and lifestyle. Obviously, we are starting to live longer now as well, and it is a condition which becomes more common as we get older because our tissues become less elastic, and therefore the hardening and furring up process is hastened. Certainly in women, we're protected until the menopause by our levels of estrogen, which help to keep arteries elastic. But once we go past the menopause and we're spending longer and longer in later life now past the menopause, then female risk becomes as high as that of males.
Do you know what? This might be a daft thing to say, but I think part of it is because we can't see our heart. I mean, I know it's really silly, and then people just think, well, okay, I can't see my heart, but don't really concentrate on it that much, and then it's like the heart attack that comes out of nowhere. I don't know where that came from.
You make a very good point. We all feel invincible. We all think it won't happen to us. And as you say, the first sign that you've got a heart problem is often when you collapse with a heart attack. Yeah. And of course, ideally we want to find out in advance what is our blood pressure, what is our cholesterol, what can we do to improve our health and stop that heart attack from occurring.
Right. So, blood pressure and cholesterol, they are two distinctly different things.
They are, but they both relate very importantly to heart health, and they're both things which hasten the furring up and hardening of the arteries. If your blood pressure's high, then the lining of your arteries get a pounding and they become damaged. If your cholesterol level is high, then your bad cholesterol, the small particles, can seep into those damaged artery walls and cause them to fur up.
Okay. Now, your blood pressure, I know for a fact that in Nottingham anyway, you can go down to Asda, down on Hyacinth Green, and you can just ask for a blood pressure test free of charge. So, I know you can go to the doctor, but sometimes people like to go elsewhere, and you can go to chemists as well, can't you?
Yes, many pharmacies now offer to check your blood pressure and also to check your cholesterol. There might be a small charge for that, I'm not sure, but certainly you don't have to see your doctor. But if the result comes back raised, then obviously you will need to. And you also don't just want your total cholesterol amount. You want to know the balance of good and bad cholesterol, because if you have a high cholesterol and it's all the good form, then you're not really at risk. It's if you've got a raised level of the lower size particles, the LDL cholesterol, they're the ones that can seep into artery walls.
Okay, right, so you're telling me something I didn't know. I didn't know that you could go and get your cholesterol checked at a local pharmacy. You may have to pay something for that, but then you ask them to tell you about the balance of good and bad.
That's correct.
Right, okay. So what kind of health supplements help to prevent heart disease?
Well, there are quite a few supplements that are beneficial to heart and circulation. Some of the most interesting ones are those that contain soluble supplements that you can add to a drink, for example, or sprinkle over your food. For example, one that contains barley beta-glucans. These act like a sponge in the intestines to absorb cholesterol so that it doesn't get absorbed into your bloodstream instead. So Help Cholesterol is the name of one of the supplements that can bring the cholesterol down.
Yeah.
And there's one called Help Blood Pressure. Great names these, they tell you exactly what they do. That contains dairy peptides. Now these are concentrated forms of proteins that are found in milk, but they have an effect by neutralising an enzyme in the circulation which makes your blood pressure go up. So by stopping that happening, it helps to bring your blood pressure down. And that's one of the ways in which some of the tablets that us doctors prescribe work as well. So if you don't want to go down the medication route, then that's something that you can do for yourself.
And I absolutely agree. I don't know who came up with the name of these, but I think that's absolutely fantastic. Don't you think? Can I have some Help Cholesterol? Can I have some Help Blood Pressure?
Absolutely.
Fine. Straight to the point. Where can our listeners go to find out more information?
You can visit the website workswithwater.co.uk. That's workswithwater.co.uk.
.co.uk. Dr. Sarah Brewer, thanks a lot for joining us this morning.
Absolute pleasure.
Thank you.